start us off is Dr. Brandon Gish, who is an interventional pain medicine with the Lexington Clinic. Welcome.
Thank you, Dr. Fox.
Now, you take care of all kinds of pain for all kinds of things.
We do. We treat all types of pain. Back pain tends to be the most common, and I think most importantly our approach is treating our patients kind of like athletes. Their sport may be taking care of their grandkids or playing golf on the weekends, though.
Well, now you mentioned back pain, and that seems to be one of the most common pains we see. What are some causes that?
Yeah, so common cause would be just muscular pain. Other causes would be disc pain, sometimes arthritis, sometimes spinal stenosis. And there's a variety of treatments for all those that we sort of identify in the office.
Now, we'll come to those treatments here in a minute, but there's a new, it's not a new diagnosis, it's kind of new to me, and there's a new treatment for it too, called Reactivate. Tell me.
Sure.
It's called
multifidus dysfunction. Yeah. So if, for example, you're working in the yard, you sort of tweak your back. Not enough to go to the emergency room, but you know about it for a few days. If you don't properly rehabilitate that in the days and weeks that follow, you may develop some inhibition of certain muscles in the back. And that can become a chronic problem if not addressed. That then turns into chronic low back pain, which may make you a candidate for Reactivate. Reactivate's an implanted device similar to a pacemaker, not like a spinal cord stimulator. This is more of a muscle stimulator to regenerate some of those inhibited muscles for patients that have had inhibition for years.
Now, you talk chronic pain. How long do you have pain before you might want to consider something like this? And is there something you do before this?
Sure. By definition, chronic pain becomes 3 to 6 months. I would say most patients that we implant this device have had pain much longer than that. But pain should be addressed as early as possible. And we use physical approaches for the most part. It's when those fail that these become options.
Okay, this is done as an outpatient, inpatient, small device, huge device?
Yeah, small device. I liken it to a pacemaker in size and implant. Outpatient, about 40 minutes. Most patients at about the 3 to 6 month mark really start noticing functional improvement. Before, they had difficulty with bending and picking things up, standing up for long periods of time, or walking. They find relief with rest. And so those are the functional markers we look for improvement.
Okay. Now, we'll maybe come back to other therapies, because there's one thing I want to get to here before you go, and I make sure I got it right, the Titleist Performance Institute for golfers.
So back pain is the #1 injury for professional and amateur golfers. Professionals tend to have high rep, high velocity that creates their pain. Amateurs bring their deconditioned spines to the course and have injuries. Titleist Performance Institute's a world leader in understanding the body swing connection. And so at Lexington Clinic, we offer this program. We do a physical evaluation, head to toe, to evaluate if there's any issues. Some of those could be flexibility, strength, or performance issues. And then we watch you swing in the clinic and match those up. And if we can find a connection, we can start a program. Sometimes that's as simple as an exercise. We give an individualized exercise program for home. Other times you need interventional techniques from me so that we can facilitate that functional improvement.
Does it make your score any better?
We'd like to think so. The goal is functional improvement and pain. Interestingly, Reactivate, we said it works on the multifidus. Multifidus turns out to be the most important muscle in the golf swing. There's a lot of extension and rotation in the golf swing. And so we have an open study right now in patients that qualify for Reactivate that also play golf. And we hypothesize that you'd be able to play more and longer with less pain by doing so.
Well, that's great information, great at what you do, and thanks for coming in and telling us about it.
Thanks a lot.
And if you have back pain, especially if you're a golfer, you can see Dr. Gish. He can help. We'll be right back.